Good to have you with us. You're watching the news. I'm Avni Raja. We're making a start with the vaccination drive, day 2 of the vaccination drive for the 12-plus age group. We're going to talk about what the response has been. Well, it's day 2 of the vaccine drive for the 12-plus age group. Compared to day 1, the response in some of the cities has been slightly better this time round. The response was extremely tepid yesterday. In fact, only about 3,800 children were jabbed in Delhi, around 124 in Mumbai, and 32 children took the jab in Bengaluru on Wednesday.
124 children aged 12 to 14 got their jabs on the first day of the vaccination drive here in the city of Mumbai. Remember, the vaccination drive for this particular age group began on 16th of March. Today is the second day, and on the first day we saw a very slow start to this particular drive. In fact, here we are at Rajawadi Center. That's the hospital and also a dedicated vaccination center. And today the day seems to be little better than yesterday. In fact, the board that you see so far in the span of 2 hours here, this center has got 19 children between age group of 12 to 14 as compared to only about 10 to 12 yesterday. So, of course, there's been a slight improvement today that the center have seen as far as the footfall is concerned. Not only this, but the other 11 centers have also witnessed a bit of the better turnout this day. But if you talk about first day, what exactly went wrong? What we understand that the vaccination drive, which was supposed to start at 12 p.m. on the first day, started only at 2 p.m. So there was a delay as far as the drive is concerned due to the technical glitch on the COVID app. Secondly, considering it was a working day where the schools were open, so not a lot of students did get an opportunity to come to the center. And thirdly, there is still sort of hesitancy amongst a lot of parents as well as children whether to get them vaccinated or not.
Well, so what is it that is causing this hesitancy right now among the children? Of course, which is the parents who are possibly hesitant at this point in time, which is why we're not seeing too much of a turnout. Let's discuss this further. Dr. Rajiv Das Gupta, National COVID Task Force, is joining us here on the broadcast, as well as Dr. Sanjeev Bagai as well. Thank you both of you for joining us here on Mirror Now. Dr. Rajiv Das Gupta, let me come to you first. What is your own assessment of what we're seeing, what we've seen in the last 2 days? Today, of course, was slightly better, but overall, it seems there is not much of a turnout among the children between the ages of 12 and 14.
Yes, thank you. That's actually the report emanating from most states yesterday and till today also. One reason, of course, is as the ground report pointed to some of the initial glitches. What's also true is that it's the holy festival time and vacation for a few days at many places. Plus, add to the fact that there has been an overall decline, and therefore, even in terms of the so-called precautionary dose or booster dose, there has also been an overall slowing down. So the report about vaccine complacency is actually correct, and that's being addressed through communication inputs. However, at the same time, as we know, there has been some increases in a couple of WHO regions globally of COVID cases, and therefore the government of India is extremely cautious about the next few weeks.
Yes, absolutely. And we're going to talk about, what's happening globally in some of the countries in just a bit. But before that, Dr. Bagai, in your view, what is it that could be causing a concern? Of course, Holy Weekend aside, but there are parents who have raised apprehensions saying that, they're not sure if they want their children to get vaccinated. What is your assessment?
Yeah, I think, good evening, everyone. So, very quick summary points is, I think one is because of the festivities and two is because of an overall decrease in COVID cases in India. There is no doubt that we have reached a significant amount of community-acquired immunity, what we call as herd immunity. We've crossed 181 crore vaccines overall as per today, which is a phenomenal achievement to have done in such a short span of time to immunize most of India. But the important point here is that the children, vast majority of them are actually asymptomatic carriers. There are reports of them being about 36%, going up to 80% of them are asymptomatic or mild carriers. Mild carriers or mild infections also are predisposed to long COVID. So I think that's important to address, that long-term organ damage can take place without actually a child knowing that the child has been exposed to COVID. Children carry the same viral load, they transmit as much as adults, and they are household transmissions. So if you immunize each child in the house, 15 to 20% per child is the decrease in household transmission, that's indoor transmission. Also, we know the school and playgrounds can become a hub of transmission that can be stopped with the immunization. It's entirely safe. There is no long-term risk with the vaccines. There is no increase in thromboembolic phenomena or any anaphylaxis or any other neurological damage. I think we need a very aggressive public awareness campaign, which like we did last year on various occasions, to educate the parents that the vaccines are safe. This is not a common flu-like illness. It has a long-term immune-based dysfunction in the body. Children can get affected, and it's extremely important to break the chain of transmission because children occupy a largest cohort of Indian population. Almost 35 to 40% of children are below the age group of 16 to 18. So this age group is extremely important, and they have to go back to school, they have to go back to the sports and continue the social life which they've been away from the last 2 years. So I think overall it's extremely important that we push this message aggressively, putting scientific facts on the table. 93% decline in infection and almost 99% decline in death rate is the worldwide figure for pediatric vaccinations. I urge all parents to understand that the vaccines are safe. Please get your children immunized as quickly as possible.
Yes, absolutely. I think awareness is something that does need to be created as far as vaccination for children is concerned. But Dr. Dasgupta, there is a section of people, in fact, some medical experts as well, who believe that children don't need to get vaccinated. And like Dr. Bagai had pointed out, that there are antibodies that I've seen in children who've been exposed without even realizing it. So there is one section that believes that it is not necessary. Your response to that?
Yes, it's true that sero surveys have demonstrated that children in India have nearly as much or as high seroprevalence as the adults. However, as we know that educational institutions have been closed for a very long time, in fact, one of the longest times in the world, comparatively speaking. And one of the key arguments was that both on the part of parents as well as the school administrations, that the vaccination of children was one of the roadblocks to completely opening up educational institutions. Now, in the government's order of prioritization, the oldest children have been immunized first. I mean, that's going on. And then the next group, the 12 to 14, is now being immunized with Corbevax. To add to the advantages and the relevance to what Dr. Bagai said, it's important to understand that in terms of COVID transmission, etc., the 12 to 18 age group children or adolescents behave nearly as exactly as adults. And therefore, the disease transmission in these groups are actually higher. And hence, there's a relevance of beginning the vaccination campaign in this group before. But that doesn't mean that we do not normalize educational and other activities for younger children, but their risks are certainly lower.
Yes, absolutely. Some extremely important points that both of you have raised. But I want to sort of extend this discussion a little bit to look at what's happening around the world as well, because China and South Korea have been witnessing a huge surge in new COVID cases in the past few days. In the last 24 hours, South Korea also witnessed the biggest spike in new COVID cases. In fact, on a single day, the country recorded over 6 lakh new cases, which is about 1.2% of their entire population. Now, authorities say that the daily infections are far higher than they had predicted, most of these cases are said to be locally transmitted. In China, about 45 million people are under a lockdown. China is facing, in fact, a strong outbreak at this point in time. Daily caseload is comparatively small, around 5,300. The Omicron variant is shaking Beijing's zero COVID strategy. In fact, this is really, at this point in time, what we need to talk about as well. Dr. Bagai, we've seen in the past couple of waves how when we've seen, this COVID spike happening in any part of the world, it sort of inevitably spreads to other parts. Is that a trend that you think will continue?
Yes, we've seen various parts of European Union, but more importantly, Southeast Asia, Japan, South Korea, and other countries closer to us, which have seen the new lineage of Omicron. So far we've been seeing BA.1. Now the new lineage which we are seeing to become more dominant is BA.2. South Korea and Japan have seen almost a 36% increase in the new dominant strain. This strain is going to behave exactly like the previous strain, in spite of it having 17 more non-synonymous mutations. So the new sublineage has mutated much more than the previous Omicron. But having said that, the Omicron is less severe than Delta. That is well proven, but it can transmit very quickly in the upper airways. So the new cases which are being seen primarily is because of very rapid unmasking policies and not as much vaccinations as what India has done. I think what has saved India and which will continue to save India, one is the phenomenal vaccine drive, but we must press on and cover more amount of population, especially in the children. And I must add the pregnant ladies, because it affects the fetus and the pregnancies itself. And the second important point is we should not be in a hurry to unmask. I think masking is something which we must persist for another 6 to 8 months to completely ensure that this new sublineages don't actually come into the community in which can infect other people.
Absolutely. And Dr. Dasgupta, so obviously it means, that there's no way that we can let our guards down anytime soon. In fact, we have to be on a very close watch to see how things are progressing at this point.
Yes, of course, that's what the WHO's message is globally. That's what the government of India reiterated yesterday and today. But let's not forget the fact that the current rise in China that we are witnessing is despite about 85% of the population being fully vaccinated. That's against the global average of 57. And that's roughly what India's average too, at about 58. In general, the Southeast Asian region is around this level. In fact, Bangladesh, Sri Lanka, they're at 60% plus. But the point is that immunity against Omicron starts waning 90 days onwards. And plus reinfection with Omicron is actually nearly 5.5 times higher than reinfection with Delta. So we can actually expect quite a bit of reinfection to happen should this be spreading in the region, in the Southeast Asian region, which is currently in the current week, by the WHO's most recent situation report, is actually at minus 21%, which means it's declining, whereas the West Pacific region, which is South Korea, China, Japan, etc., that's at plus 29%. So at this point, we may be looking fairly comfortable, but as the government is reiterating, we certainly need to keep all the cautions high.
Yes, absolutely. Dr. Bagai, there are already reports and, hypotheses that we are going to see yet another wave towards the end of the year. And of course, in the near future, we are looking at opening up the airlines. The airlines are going to open up and go back to the original schedules as far as international travel is concerned. Do you think that is something that perhaps needs to be rethought at this point in time?
Yeah, I would like to actually stress on one very simple and important fact, that the infections rate is coming down. We may have an occasional spurt of a new sublineage that is not totally unexpected, that is expected. But I don't think there is any panic. We need to be well prepared. The vaccine drives must be pushed very aggressively. We can't put that out of our radar. But my simple message to every citizen who's viewing this program is, do not remove your mask in public. Your bio bubble is your own home. But if you're exposing yourself to anyone outside, be it a market area or a mall or anywhere else, please avoid large crowded areas still for another few months and do not remove your mask. I also want to stress that these masks are not simple surgical masks or cotton linen masks or fancy masks. It has to be worn in a well-fitting and a high-grade specific N95 mask. Please protect yourself. This virus is not a common flu. It has serious consequences towards multiple organs inside the body, even with mild or asymptomatic infection. No need to panic, but please vaccinate you, your entire family, and your staff. The elderly, the comorbids, and the healthcare workers must get the booster shot. And please be prepared not to remove your mask.
Yes, Dr. Dasgupta, when then can we say, at what stage can we say that this is now in an endemic stage? I think this is also one question that has been asked very often. But do you think with COVID, with the kind of virus it is, the way it mutates, we will ever be able to get to that stage?
Probably the way this virus will behave is the way influenza viruses behave. They will possibly have seasonal patterns once this epidemic phase settles down. So there will be ups and downs. The global surveillance system today is much stronger than what it was. Testing capacities are much larger. Doesn't mean that we are testing as much in terms of numbers, but the capacities are certainly a lot higher. We know how to switch on, when to switch on, and certainly some of these precautions need to be maintained. That means that communication inputs on the part of governments and government agencies will need to be sustained. So neither can caution go down, nor should investment into these go down.
Absolutely. Dr. Rajiv Dasgupta and Dr. Bagai, thank you so much for joining us and giving us your perspective. So the message is very clear that there's no need to panic, but it's definitely not time to let down your masks.